Hello, everyone. Welcome back to Axon Health. Today, I wanted to talk about something that I've been asked by a friend, and it was something I was thinking about. And then, what that question was is what is chiropractic? What's the research say? What do we see anecdotally in practice, and what chiropractic can do for you? Excuse me, and how it can be integrated into the healthcare system. So, chiropractic is an alternative form of care that the main therapeutic um, modality used is spinal manipulation or SMT. Whether it's cervical, thoracic, or lumbar spine throughout the spine, SI joints, and then anything extremities and so forth. And then in school, 3.5 years, it's a pretty vigorous program. We get background in all sorts of things. So a lot of anatomy, physiology, pathology, neurology, microbiology, biochemistry, lots of nutrition, and so forth to help give other types of care recommendations or know when to send to other places. So I think one of the biggest misconceptions is chiropractors just fix backs, and that's just not true. We actually get almost the same, like when the medical doctor, neither one's better. They both have their purposes. But medical school itself, not residency, we get the same teaching majority on a lot of the same cases because chiropractors are considered primary cares in almost 40 states. And that's not because we treat those conditions, but we have to know when to refer out and where to refer to. That is huge. So if you have a person that comes in and you're suspecting a AAA, an abdominal aortic aneurysm, and you do an abdominal exam on them and you see pulsations, high blood pressure, maybe perspiration, things that don't add up, you know to send them to the ER or stroke stuff, a lot of neurologic stuff, and so on and so forth. And this is a really good thing because we could be integrated into the system of, because there's not enough primary care people out there of knowing when to send. So we get a lot of that in school. Like I said, we get a lot of nutrition. What else do we get? A lot of musculoskeletal is probably the main thing chiropractic is correlated with, helping musculoskeletal conditions, whether that be trigger point release or Graston, some type, whether you believe or don't believe in cupping, and like I said, the adjustment itself. So the actual science behind the adjustment, the neurophysiologic component of it, has some pretty good literature. There's a couple podcasts I recommend. The Evidence-Based Chiropractor, who does a weekly episode every week on science behind the adjustment or how it can be integrated. We get a lot of stuff concerning radiology, not so much MRI and CT, but we can look at the basic stuff and say, okay, something that's an abscess or that's a fracture in the cortical line, and when to refer out. Probably 6 or 7 radiology classes that are pretty in depth, and our national boards. We have to shoot radiology, actual shoot on patients, and then write reports, and then go over those reports in front of a clinic radiologist, which can be it can be stressful. And but yeah, that's basically the background behind what chiropractic is. And chiropractic can help with, like I said, a wide variety of musculoskeletal things. We could be a great integrated part into the healthcare system. One big thing is chiropractors that say they can treat everything. It's just not true. We have been shown very good relief with, say, low back pain or facet syndrome, and so on and so forth with that. So we treat a lot of stuff like that. There's a lot of anecdotal stuff, case studies. So like something happens weird, spontaneous when it comes to like children with asthma. There's no substantial research. So if a chiropractor is saying, "Oh, I treat asthma," be very careful of that. There are cases where it happens, but it's not something I would say I treat. I would say I treat mainly musculoskeletal conditions, and then things happen that I can't explain whether they're placebo or not. So hopefully this was a good definition of what we do. And, like I said, I think integrated healthcare is huge. Being able to know when to refer is a major reason we take a lot of pathology because, like I said, we don't treat a lot of these major illnesses. But if they walk into your office, even if it's only 1 to 2% probability that a low back disorder is something more sinister, whether it's a benign bone tumor or a malignant tumor or Mets or, like I said, a triple A or something really serious, we need to know how to examine that and know when to refer out and knowing our boundaries as well. So, as I said, we don't treat everything. We do a lot of co-managing. So, patients that might have some chronic pain from some really severe stuff, chiropractic would be a great choice in the beginning. I think it's always good to see either a chiropractor, physical therapist, or massage therapist. Always try the more conservative approaches, and surgical intervention should always be last. If you're going to someone, and that's not all cases. I mean, if you get into a car accident and you fracture something severely and you need fusion, you're not getting conservative care first. But there are too many people out there that don't follow recommended guidelines by the American Chiropractic Association, by the American Family Physician, by the American Radiology Boards, and they're either shooting images when they're not necessary or they're jumping straight to surgical intervention, and you're not even giving the patient a chance to try something that's, might be more effective, less costly, with way less side effects. So I think that's why chiropractic physical therapy have been a lot more now integrated into healthcare, more so chiropractic, because there was a lot of stigmas and people just didn't understand what chiropractic was about, rightfully so. Chiropractic 65 years ago was a lot different than today. The straight chiropractors, as we call them in school. But, we get a wide variety of topics taught in school. And I don't compare myself to a medical doctor. Residency I heard is brutal. We have clinic for a year after 2.5 years in the classroom. And clinic it's fun, but it's not, I'm not there 90 hours a week. So I thank all medical doctors or all other professionals, what they do, physical therapists, occupational therapists, massage therapy. Everyone can give something to the patient, because remember, the patient is always first. At least it would be more optimal if it was viewed in that sense. So I hope you guys enjoyed this video. I hope you understand a little bit better about chiropractic, what chiropractic can do for you. If you have any questions, feel free to shoot down below. If I can answer them legally, I can. If not, I can recommend you see someone to ask in person. And that's that. So thanks for listening again, guys. Have a good day.